response to the oscillating light. Similarly, you can carry out another experiment. Here's one where we treat both eyes, just by contrast. And you can see that when you treat the eyes, both of them have a very nice response to the different wavelengths. And similarly, when you oscillate, both treated eyes now respond. So again, these photoreceptor progenitors are having a very significant neuroprotective effect. We also are finding now, and we'll have some work that will be published soon, that will show that they not only have a neuroprotective effect, but you can actually, as I showed you in the RD1 mice, actually have blind animals when you're going in with these and actually connecting up to where there were no photoreceptors initially. So moving on to another cell type in the eye, we are also looking at ganglion progenitors, because of course glaucoma is a major disease that affects millions of people. And so we have two different animal models we looked at, the optic nerve crush, which is physical damage to the optic nerve, and another one is glaucoma models in both mice and rats, where you can put microbeads in and cause an increase in intraocular pressure that mimics what you see in humans. And when we transplanted these photoreceptor progenitors, which we can generate in very large numbers and in very homogeneous populations of cells, you see that they mature and form very nice neurites in both of these different models. So the hope is that we can use these to treat patients who have glaucoma. And similarly, we're seeing that they have a survival effect on the damaged ganglion cells. So here you're seeing actually a cross-section here in an untreated animal, and you're seeing that there's the blue of the remaining ganglion cells are almost all missing. By contrast, after when you transplant some of the photoreceptor progenitors, and just see the survival, and another spot in the retina, you see very nice rescue of the ganglion cells. And you can also carry out what's known as the scotopic threshold test, and this is one of the best measures we have for ganglion function, and we can see that we get a very nice response in these animals after they've been treated with the the ganglion progenitors. So we're also looking at another cell type. So as I mentioned, those were studies that were carried out in the eye because it is an immune-privileged site. But also mesenchymal stem cells are unique in that they're also immune modulatory, so you can transplant those without immunosuppression. And MSCs, as you probably know, can found in bone marrow, adipose, and umbilical cords, and they differentiate into a number of different cell types. But importantly, they exert immunosuppressive effects, and they facilitate tissue repair. And we've actually figured out how to derive these from a hemangioblast intermediate, and we call these cells hemangio-derived mesenchymal cells, which we for short are HMCs. And so we're, obviously this is coming from an unlimited starting source of embryonic stem cells. They're very easy to derive in large numbers. In fact, we can derive these 4 to 5 orders of magnitude in greater expansion than, for instance, the gold standard, which is bone marrow-derived MSCs. We've shown that they're immune modulatory, so you don't need immunosuppression when you use these in patients. And they only exist transiently, so they exert their effects, and you don't have to worry about tumorigenicity in the long term. And we've shown that this is a very strong, broad platform technology. We've actually now treated 6 different indications using these cells. And there are a number of reasons we believe that these may be more potent than the usual cells that are used in clinical trials. Not only do they have better migratory properties than, say, cord blood or bone marrow blood, but they also have reduced levels of certain pro-inflammatory cytokines such as interleukin-6. And because they're coming from a pluripotent stem cell source, you can create unlimited numbers that are non-variable under GMP conditions from these cells. So they express a variety of immune modulatory and anti-inflammatory activities. So for instance, you can show that the cytokines are upregulated that modulate the behavior of different immune cells. In this particular case, heme oxygenase is upregulated. That's a potent anti-inflammatory effect. Also, there are other anti-inflammatory agents that are secreted in response to these cells. These cells enhance regulatory T cells, and they inhibit T cell proliferation. And this is a study we recently carried out with researchers Dr. Wang at the University of Connecticut. here, and that paper was published last year. And in this case, we're working with an experimental autoimmune encephalitis model, which is very closely mirrors multiple sclerosis. And what we found is that basically what happens in this model is that as multiple sclerosis develops, the animals become paralyzed. And so at 0, that's a completely normal animal that's moving around like a normal mouse. At 2, the animal's dragging its limbs, and by the time it's up to 4, it's completely paralyzed. And what we showed is that if you don't treat the animals are paralyzed. And here you see one of the animals that's untreated, it's just staying there. By contrast, if you give it a single injection of our cells, the animal is moving around quite normally. And this table here shows you what happens. So here's a control animal. If you treat with the bone marrow-derived MSCs, you get a slight response. But again, the animals will still remain paralyzed, like this animal there. And by contrast with our HMCs, you can see that the animals are not paralyzed. You can even irradiate these cells before you transplant them, and they still reverse or prevent the onset of this disease. If you look at what's going on histologically, you can see that the MSCs derived from the embryonic stem cells, but not the ones from the bone marrow, prevent demyelination in the central nervous system. So here you're seeing demyelination in these animals. And even with the bone marrow, you can see in blue that there's still quite a bit of demyelination. But by contrast with the ES-derived MSCs, you can see quite a difference in the two groups. And we think one of the reasons for this is something known as extravasation. So if you use the bone marrow MSCs, what you're actually seeing is they get to the central nervous system, but they seem to get trapped here in the vessels. And the human cells are there stained in green, the GFP positive. And so they're not getting out of the vessels and into the tissue to repair it. By contrast, the ES-derived MSCs, you can see that they've extravasated, they've transmitted, migrated out into the damaged tissue where they can exert their effects. And we've confirmed this by looking at a number of different proteins that are involved in extravasation. We've also looked at some other animal models. We looked at an experimental model of uveitis. Uveitis is an autoimmune inflammatory disease of the uvea, and it accounts for about 10% of blindness in the United States. And so we can, again, like we do with our patients, we can look into the eyes of these animals to get an idea of what's going on in real time. And so in a mild model, you can see this inflammatory infiltrate that occurs, and with the use of our MSCs that we derived from the embryonic stem cells, we were able to eliminate that. We repeated that with a severe model of uveitis, and again, what you're seeing here is a severe host infiltrate into the eye. By contrast, with an injection of our MSCs, you can see that process has been eliminated, and this is just a quantitation of that, and you can see the dramatic decrease in the number of lesions with the treatment of these MSCs. So these can be used for a wide range of autoimmune diseases. In humans, there are about 100 different autoimmune diseases. One that's an important one is this lupus. You may know some people who have it. It's a systemic autoimmune disease that can affect virtually any organ in the body. At least 300,000 people, up to 1.5 million in the United States have this disease. There's no cure, and nothing has been approved for this for many, many years. And about 50% of lupus patients develop what's known as lupus nephritis, and you can actually see what is occurring. If you look at the kidney, the glomeruli, this is a healthy glomeruli, and then with lupus, you can see the deposition of these immune complexes. And that leads to kidney failure, and we can actually study that in this mouse model, this NZBW ZB mice. They spontaneously get this lupus. And in the untreated animals, you can see here in red, the animals start to die from kidney failure quite precipitously. But a single injection of these MSCs or 2 injections of a smaller number here, you can see that it prevents the death of the animals. And more importantly, it actually is preventing the damage to the kidney. So when the kidney gets damaged, you start to see protein in the urine, and that's called proteinuria. So in the untreated animals, this is the degree of proteinuria. But in the animals that got 500,000 doses of these MSCs, you can see that it brought that down to a very, very low level. So very significant impact on the pathology of the kidneys. And you can look at BUN, creatinine and all, and you're seeing similar reductions as a result of these MSCs. And you may be thinking, oh, this is great, it works in mice, but will it work in humans? And there was recently a study that was carried out by Dr. Sun's group where they had 40 patients that were treated that had refractory lupus, and they were given MSCs that were derived from umbilical cord cells. And about 60% of those patients had a major or partial clinical response. And in an earlier study, they actually also had a profound therapeutic effect, but long-term improvement in the disease activity, renal function, and antibody levels. So you would expect